Welcome back to part 2. So my interview with Dr. Jeff Gross went into such a deep analysis, first in part 1 on the broken system of healthcare. And then we went into what we really should be looking for or focusing on when it comes to our health, things that they didn't learn in medical school. So I had to turn this into 2 parts. This is part 2. Learn about a deeper dive into your health with a functional medicine mindset. One thing I wanted to talk about, so that was statins, and I believe statins are actually the number 1 prescribed medication in America. And then you made a comment about the risk factor of heart attacks, and heart disease is actually the number 1 killer of women.
Yep.
So this is this is something that women don't know this, or men don't.
But let's
know
talk about that, because it's the number 1 killer of women who are not hormonally optimized. But no one says that. But look at the data. Women don't have heart attacks until after menopause. And the group that has them is the non-bioidentically replaced or optimized group. It's the people who they go to the doctor pats them on the back and says, it's okay, this is natural. You'll just go through this decline, you'll be fine.
Well, hormones cause cancer and cause strokes.
No, ma'am. The absence of hormones cause cancer and strokes.
Exactly. But that Women's Health Initiative in 2002 totally took away, and it would be really interesting to know what the powers that be, what was the yacht talk then? What was the lobby talk then that got that whole thing happening? So yeah, BHRT, bioidentical hormone replacement, that's natural with our body, is really a preferred option by most functional medicine MDs.
Yes, and any other types of clinicians now. And, it's something I've bought into years earlier, although I don't really practice that side of medicine much. I do a lot of anti-aging stuff that falls out of my regenerative medicine practice, so I'm doing more and more of it now. And the regenerative medicine things we do, stem cell-based things, do better in a person who's already optimized, including hormonally optimized. Men, women, what have you. And it's starting earlier. I'm seeing men in their 30s with low testosterone. I'm seeing women with perimenopausal levels and maybe symptoms in their 30s and 40s.
I'm seeing osteopenia and osteoporosis diagnoses in younger women as well.
Yep.
Okay, so you do regenerative medicine, anti-aging.
Yep.
And so you do work with women with osteoporosis or osteopenia?
Yeah, one of the low-hanging fruit applications of the stem cell-derived signaling exosomes, which we talked about more last time, is for improvement of bone density. So in specific areas, the high-risk areas are the hip and the lower back. And that's why when you get a DEXA scan, they look at those 2 areas. The third place they might look is the wrist. Why? Those are the places that go first. So we can treat those areas and help support the body's ability to build bone. But you've got to be hormonally optimized. You got to have more than enough vitamin D3. Okay? Not just one little vitamin pill a day. You may need more. And that's another lab test that's the normal level is too low. The normal level for vitamin D is usually up to 100 in most lab tests. That's the amount not to get rickets, which is the vitamin D deficiency. That's not the optimal level. I like people up towards 150, 130, 150.
Wow.
No, I don't think it's a wow.
No, but wow, because I haven't heard that. And I don't think that that's what is said more. Well, let me ask you about that. So if I try to think about like nature and what does nature provide, right? Most vitamin D is in organ components of meat, lots of animal products, very few. It's not really in the vegetable world. It's in mushrooms. And then, of course, sun exposure. So let's take the reality of the world and 8 billion people that live here. And if vitamin D, I know vitamin D is super important, right? It's a prohormone. It's a vitamin. It's super, super important. So what does really make sense with vitamin D? Because could we, there's lots of parts of the world, like India, so much of India is vegetarian. And then also there's a certain band around the world. If you live, like LA is in that zone, at Los Angeles where I live, and probably even Las Vegas where you live, there is a band where we're optimal exposure to the sun that's going to create great synthesis in our bodies if we do it with our arms, our legs, our torso, front and back. So what really makes sense? Like, if this is what we really need, like, are we all supposed to rely on a supplement? Like, does that make sense?
Okay. For thousands of years, humans have had some type of animal milk as part of their diet. Dairy. That's a big source. We're not doing that anymore. And if we are drinking milk, it's watered down, right? It's skim or it's whatever, or it's oat, or it's not from an animal. So we're not getting the vitamin D. So nature, we had this relationship with nature, and now we've given up on that to some degree. So I think whole milk drinkers are okay. Raw milk drinkers are okay. And we're talking daily consumption. I just don't think you get enough from the sun. The sun does not make vitamin D3. It converts vitamin D2 to vitamin D3. So you'd have to go measure your vitamin D2 levels and figure out how to get that. So that is a challenge. So you can do it, but and again, how much sun? I like the sun, but I'm worried about my skin too. I'm very fair, and you're fair. So we have to be careful. Then you start to put on sunscreen, and now it's got issues, right? It's got all kinds of poisons in it. And are we cutting out some of the rays of the sun with that sunscreen that actually activate the vitamin D2 to vitamin D3? I don't know. So I'm a heavy supplementer, and I'm not worried about it.
Okay. Like, what's heavy?
Well, I don't absorb well. So I was taking at least 10,000 IUs a day, international units a day, but now I do an injection once a week.
And you're also monitoring that with testing.
Of course.
Yeah. Okay, that's good to know, because it plays a critical role in bone health, right? It's one of the main regulatory areas of bone metabolism.
Yeah, I think we talked about this once. I think my recipe for bone, you added to it last time, but my recipe for bone is a minimum recipe is optimal hormones, vitamin D3 in healthy amounts, and weight-bearing exercise. But strategic and good and intense, the use of the long bows.
Yeah. Which is great coming from a doctor, because it doesn't sound like Avinity or Prolia or Alendronate.
Those things might help in one pathway, but throw off other pathways, and it just doesn't. Yeah, it might grow a little bit of bone, but then what'd you get? So did you get a kidney stone? What happened? So you got to be careful with these pharmaceuticals. They're not nature.
Yeah.
Things that are bioidentical or biomimetic or agonistic or antagonistic properly can be naturalistic or close to natural. Like you take GLP-1s. I'm a big fan of GLP-1s. Those are synthetic, but they mimic almost identically some of the peptides involved in the glucagon molecule, which bind to these glucagon receptors, right? So, and those have had far-reaching effects for health and wellness beyond just their, paid-for reason, which of course is the diabetic piece. So for weight loss, for reducing inflammation, for prevention of inflammatory damage leading to cancer, dementia, and other problems, which we are now seeing in these longer longitudinal studies. But will your insurance pay for it? No. So you have to go out and get it.
Yeah, what I see with that stuff, because I don't know enough about it, my friend is a pharmacist, told me 1 in 8 people in America are on a GLP-1. So, but what I really see as a benefit, I don't know enough about the biochemistry or physiology of it, but what I do see from a mental emotional layer, that when somebody, and I've had, when I had my hip replacement, I weighed as much when I had that hip replacement as I did when I gave birth to all 3 children. And I was fat and miserable. I just was, because I couldn't move. My hip joint was collapsed. So if you have extra weight on you that is debilitating and mentally, emotionally bringing you down, and if you can get that off of you and then kind of learn whatever the other parts, then managing emotional eating and all the other things that come along with, here you are now, this is what you use, now figure out how to get yourself into a good place. I think it really plays a great role there.
It's amazing. I'm a big fan. Personally and professionally, we do a lot of GLP-1 management for reasons other than weight loss, in addition to weight loss.
Well, and I trust you. And so I think that because of so much of what your mindset around health, wellness, and medicine, then if you're going to stand behind something, then it makes sense that that could be good. Because I don't know enough about that. I don't think I need GLP-1. I think I just need like some management of, I don't know, maybe cutting out the whiskey.
Well, you shouldn't cut out all the things you love, and it may not be for weight management. It may be for a strategic way to reduce inflammatory pathways in your cells, AKA longevity, fostering longevity. Slowing the inflammation is slowing the aging.
Okay, so what about somebody that has, like I did the function lab with Mark Hyman, and they look at, I guess they're ANA markers, ANA markers. Those are DNA inflammatory markers, aren't they?
Yeah, ANA is an antibody against certain DNA and DNA-related proteins, usually from cells that have spilled out, because DNA is usually contained in your cells, but some spills out from senescent cells or something. They can get, if they're low elevation, they can get triggered by parasites. If they're high elevation, then you can have what's called lupus.
Oh, so interesting. I'm seeing so many people speaking about parasites, like even, some of the bigger players in the wellness space. I've just like through my emails or through some of the summits that have been happening lately. And it's really interesting because I run stool labs. You run stool labs, right? Is that
when needed? Sometimes, yeah.
So what do you do to detect parasites in your
Well,
practice?
you start out with just some basic blood tests, right? There are some markers for those. You look at a blood count, you look at the eosinophils, which are a particular subset of cells in the white blood cell system. So you start there, and then you could do these titers. There are different types of titers. There are parasites that have markers. You start there. You can do the stool test as well, but that's when you have flagrant parasites coming out of you. And usually that's from travel to a different country, or that doesn't have the same standards we have. Or you have poorly washed vegetables in a salad at a restaurant somewhere that, you shouldn't have had. And then you start to get those things. So make sure to wash your fruits and vegetables really well at home. But these are usually easily treated, ivermectin, mebendazole, these are simple treatments. You can get them at Tractor Supply. You can get ivermectin at a Tractor Supply store for, $12 and treat it. They offer it there for horses, but it's a lot cheaper than going to a doctor to tell you he won't give it to you.
Yeah, it's crazy. We had a horse for 10 years and we used ivermectin to deworm him. So we would prophylactically give him ivermectin. We would buy this tube, it looks like a tube of toothpaste, and put it in his mouth. Yeah, because it's a dewormer. Now, some of the stuff that you were just talking about right now, did you learn that in medical school?
Absolutely not. They would shun me for saying this stuff in medical school. It's not part of the Kool-Aid driven script.
Yeah, and do you see that as being a driver behind some diseases?
Yeah, cancer is a big one. A lot of cancers tend to have parasitic origin. Not all, but a lot. For a lot of my cancer patients seeking alternatives or augmentative therapies, we're doing ivermectin, we're doing high-dose vitamin C. I mean, that's a no-brainer. If you've had cancer and your oncologist has not offered you vitamin C, even as an add-on IV, high-dose vitamin C is a well-known, potentially helpful, easy thing to do for cancer. So look it up on PubMed. There are tons of protocols on high-dose IV vitamin C. So we do that, things like that. I mean, IV curcumin from the turmeric root, that's a no-brainer. It's not going to hurt you.
And you didn't learn that in medical school either.
Absolutely not. That's supplement world, right? That's not science. That's supplement. Of course it's science. There's plenty of science behind it. Look it up. That's evidence-based. It's out there.
Do you do IV therapy in your facility?
Some, yeah. Well, of course we do the, stem cell-derived exosomes and natural killer cell exosomes. But for those who are looking for additional treatments, augmentative treatments, or alternative treatments for cancer, we have vitamin C, we have the curcumin, we have a few other things that we might customize for the individual. Do
you do a lot of alternative or complementary cancer treatments?
I'm not going to say a lot of. It is something we offer because we're one of the few clinics that has the natural killer cell exosomes. So when people come to me, they're seeking that alternative and they're looking for the full spectrum of what else they can do, either after or in addition to or instead of. And if it's, I go over everything, chemotherapy has a role. It's very effective in certain cancers. there's a downside to it. And we talk about it. And radiation, same thing. And some of these things are more traditional than they are evidence-based, and there are newer things. So maybe we try one avenue. And if it's not working, we can change. We don't have to stay with it. So we have a very flexible approach to working with individuals based upon their own desires. I just treated someone, I have to say this because I talked to him this morning. It came from our neighbor to the north, actually, Canada. And they came down. It's a man who's had this squamous cell cancer in his throat, and he's trouble swallowing. It was trouble talking, these balls sticking out of his neck and things. And he did all the homework. Doctors in Canada weren't very aggressive, and he didn't really want the chemotherapy and radiation. And he seemed like that wouldn't be a good option for him anyway, or it would cause a lot of other problems. So he's had this for a few years, and we gave him these natural killer cell exosomes IV, and I injected these masses in his neck, and through his mouth I injected some I could see. And today was, I think, 5 weeks, and he's already talking and swallowing better. And they think these masses are getting smaller. They're going to measure them, and we're going to track them. But I'm very enthusiastic. He's had this for years, and all of a sudden, no one's had anything. I also have him on an IV vitamin C protocol up there. They found a friend that could do it for them.
Wow.
So there are options outside of what the oncologist might traditionally offer. I'm not saying they're wrong, but you got to look at all the options and make a great decision based on, the information you have. Cancer's scary. You got to act. You got to do something.
Yeah, in the bone health world, because that's where I live, we talk about BHRT, bioidentical hormone replacement. And women that have cancer, that's where it's always kind of a, iffy, like, can they go on hormones? And so how do you learn about that? Is there research that we know about?
Yeah. Yeah, there are a lot of research. Most of it's quoted in a book called Estrogen Matters, a great book. And you can see the evidence out there that taking estrogen doesn't, at least in the breast cancer world, doesn't meaningfully increase the number of or risk of cancer, breast cancer, even in someone who's had it. I mean, there's a lot of good research. So it just depends. There's many things have been looked at, and you have to just scour the research, see what's useful, see what was quality research. And if there's nothing, then you got to think critically and logically and look at the biology of it. Why do breast cells want estrogen? Because it's part of their normal cycling. It's like feeding your normal cell, right? They need estrogen, they need progesterone. When you start to lose those, the cells get hungry and they build more receptors and they're looking for it. And some of those cells they're so hungry they develop a growth advantage and become a cancer. And if you still have that estrogen or progesterone receptor positivity, those cells are close enough to normal that sometimes feeding them that estrogen or progesterone quiets down the hungry birds. So that wasn't the school of thought a little while ago. We're seeing the same thing in the prostate world for men, where testosterone may be helpful. We're all afraid of it. It may be helpful. I mean, estrogen used to be a therapy for breast cancer many decades ago. It wasn't well tolerated because a lot of fluid retention and things, but, why did we abandon that? Like, there was information there. Again, lack of critical thinking because corporate practice of medicine and dollars are more important than patients. Not here. I can't live with that.
Yeah, you definitely take the Hippocratic Oath. I would say that you're definitely heart-centered with what you're doing.
Appreciate that.
So you have mentioned quite a few times that the data is there, the research is there, find it, look at it. Are there sources? I think that in addition to everything else we're talking, there's also a control when it comes to search. So when you do a Google search, you're going to get some of the big players over and over and over. They're definitely going to be on the first page. They're going to see them over and over and over. I know that one in particular, I'm not sure if it's one of the big ones. I can't remember who it is now. I'm trying to think, but they have like so many writers working for them, writing articles. So they're going to SEO at the top health line maybe. Or
Oh yeah. You got to search the medical literature. You got to go to PubMed. So what I usually do if I'm doing a deep dive is I'll put in the topic or a few keywords and I'll put in the word PubMed, PUBMED, because I only want to see published literature in the journals. Now, some of those journal articles you can't get to, they're behind a paywall, which I think is ridiculous. That's not helping anybody, So You find a really good review article you can get to, and it'll have all the references, and sometimes you can chase down the references. And it's a good place to start. A nice review article is usually just a summary of what's out there. It's a great place to start there, and then from there you can dive deep. Now remember, most medical research only goes back to the early 1960s online. But there are a lot of great clinical observational stuff that came before the advent of x-rays and CAT scans and I'll say the de-patientification of medicine, where we barely even look at a patient or talk to a patient or touch a patient, which is wrong. We should be. That's the practice of medicine. I know orthopedic surgeons that throw up an MRI and decide whether or not someone needs surgery of the low back without even touching the patient. That's danger, in my view. But it's out there. That's the watered-down, Kool-Aid-driven system. But you search these things on PubMed, and if you can get access to a university library that has the medical journals, you can go back into earlier stuff. And the articles are longer and more descriptive and more flowery about the patient presentation and the observations, and you can find the patterns better. And if we're going to train AI, I know I'm taking a little jaunt here into AI with you. If we're going to train AI, it's got to be trained on all that old stuff that's not digitized, because that's where the real pattern recognition meat is. We need that.
Yeah, and that could happen because the AI, you can actually talk to it now. And so if you could read that text, but there would have to be a motivation. And so I think that that's what all of this hinges on, is the motivation. What is the motivation? And in medicine, as it is now, the motivation is profits, and it's big pharma. It's an institution. It's a machine. And so I think that is what this all hinges on.
Agreed.
Yeah. So when you mentioned the word paywall, do you think that paywall might have been put up is the paywall put up because we really should be, that's where we should be looking? Do you think that that's where we should be looking more? Like, what's the paywall for?
These journals have egos, and they want to pay their editorial board some money, and it's just academic, you got to pay for this, journal. I don't think it's anything but a money game and an ego game.
Okay, so I'm going to definitely share this in two pieces because it's a lot to digest and there's a lot of great information. Anything you'd like to say before we say goodbye for now?
I'd like to say thank you for having me back. I'd love to be available to you and your sphere at any time that questions like this come up, and I enjoy answering them and cutting through the crap and getting right down to the facts. And if I don't know the answer and I don't know everything, we'll look it up and we'll learn it together. And you see those funny Google mugs those mugs that say doctors walk around with, like, don't let your Google search question my medical degree type of thing. No, I want to be questioned. I want you to bring in what you've read online. Let's either demystify it or look into it. Maybe it's something I learn more from my patients than I will. Help me research it. Let's do that together. Question authority here. Get other opinions. Don't take no for an answer.
So we always say, who taught you that? They say Dr. Google, but you're saying, no, I am Dr. Google. Go ahead and Google.
I'm not Dr. Google, but be Dr. Google.
Yeah.
Do your homework. It's a great starting point for informed consent. Doctor, I read this. Is that true? Well, no, yes, let's talk it through. Here's what it's a great starting point. It's like your class gave you questions to ask today. It's a great starting point.
Yeah, I'm going to say that if your doctor is not up for questions, find another doctor.
Absolutely.
Yeah, that doctor is in the system, the broken system, and the doctor that's going to be like you is somebody that's outside of it.
Thank you. Yeah, I'm the counterculture doctor all of a sudden. I didn't brand myself. I didn't think I was going to be that way, but it felt right, and it is right.
That's how I am. I'm such a nonconformist. I cannot help. There's so much work and so much energy I have to put into what I do, but I can't not do it. It's like it chooses you.
Yeah, I agree.
Yeah. Okay. Well, thanks so much for sharing your wisdom with us.
Of course. Yeah. Anytime.
Thanks for joining me on Stronger Bones Lifestyle. Are you ready to take charge of your future? For show notes, resources, and information on my programs, please visit DebbieRobinson.com. If today's episode empowered you, be sure to subscribe, leave a review, and share it with someone who needs it. Together, we're building stronger bones and stronger lives. Take care, and I'll see you in the next episode.